episode of CFNS podcast series. I'm your host Simran Singh. Today, we are here to dive deep into the topic of anemia, a condition that affects millions of people worldwide. Anemia not only impacts physical health but also has far-reaching consequences for mental well-being and socio-economic condition. Joining us today is Dr. Kapil Yadav, who has been a faculty member at the Center for Community Medicine, AIIMS, New Delhi since 2003. He is the principal investigator for the National Center of Excellence and Advanced Research on Anemia Control. His research interests include anemia, public health nutrition, micronutrient, and iodine deficiency disorders. Dr. Yadav is the national coordinator for the Iodine Global Network and has consulted with WHO, UNICEF, and other international organizations. With over 90 research publications, he contributes to academic and public media and has received the Sri Aran Roy Award and membership in the National Academy of Medicinal Sciences. We welcome you, sir, and we hope that you'll help us to better understand this condition. So let's start by defining the anemia, what anemia actually is. So could you please provide a brief introduction or give our listeners a clinical definition of what anemia is and how it is linked to hemoglobin concentration in the body? Also, what are some common symptoms of anemia? So over to you, sir.
Yeah, thank you, Samran. Anemia basically is defined as decrease in number of red blood cells in the body or decrease in the capacity of red blood cells to carry oxygen to the periphery of the body. Anemia can be variably defined as a sign, as a symptom, or a disease because it's a multifactorial uh, condition, and there are at least 400 different medical diseases that are associated with anemia per se. Now, coming to the what are the signs and symptoms of anemia? Anemia can manifest as very innocuous signs like just generalized weakness, fatigability. It also can lead to or predispose you to infections or other morbidity issues, and it can, in a very severe cases, can lead to mortality also. So the whole spectrum of conditions can occur because of anemia. Recently, there has been very strong linkages of anemia with the cognitive development of the young children. So that also could be one of the manifestations of anemia. Thank you.
Thank you for explaining that so clearly. So we move on to the next question. Many people experience symptoms of anemia, but don't seek medical attention, often dismissing them as normal or not serious enough to require a test. So why do you think people wait too long to get diagnosed, and what are the risks of delaying testing and treatment for anemia?
Basically, I'll not label it as people delaying seeking testing or care for anemia. Basically, as I said, it's a iceberg disease. Most of the people are not even aware that they have low hemoglobin. They generally consider if I'm feeling fatigability, I generally tend to believe maybe I'm overworking or there are some other causes. Second reason why people don't seek care because of anemia, it's an insidious onset. It's not an acute onset disease. So gradually it worsens over a period of time. So these are the two reasons why people don't generally seek care. Only in cases of very, very severe anemia, where your hemoglobin is less than either 7 or 5, or you have cardiac decompensation, difficulty in breathing at rest also. In those cases, people might seek medical care. To offset that, what we have suggested is sort of an active screening for anemia. Anybody who's, especially in pregnancy, everybody should be screened for anemia at baseline and at every subsequent visit to the health center. Similarly, in schools, young children should be screened for anemia at least once every year. So that I think these are the various modalities that national program Anemia Mukt Bharat predisposes or suggests for testing of anemia. Coming to what are the risks of delaying the testing, and they are very obvious. This thing, if you don't identify anemia at an early stage, it will further worsen, and the treatment and complications would be much more, and treatment would be much more difficult as you delay. In very severe cases, like in pregnancy, you might end up during delivery with postpartum hemorrhage or excessive bleeding during pregnancy. That also can lead to a prolonged stay in hospital, or in some of the cases can even lead to death. So even around 50% of maternal mortality is because of hemorrhage during childbirth, and one of the common reasons for hemorrhage is anemia. Thank you.
So my next question is that there are several types of anemia, each with its own causes and characteristics. Could you walk us through the different types of anemia and how they differ in terms of symptoms, causes, and treatments?
As I earlier said, around 400 different diseases are associated with anemia. But broadly, we classify them into three groups. One is nutritional causes of anemia. Second is caused due to inflammation or infection. Any chronic infections or even acute infection would manifest as anemia. Third cause is the genetic causes, which so basically the sign and symptoms of anemia would be similar for different causes of anemia. The severity might vary. Like if you see in nutrition anemia, if you look at iron deficiency anemia, so most cases of severe anemia are because of iron deficiency anemia. So that is one lead that you get. What are the causes of anemia? Second, you come to if you look at non-nutrition or non-iron deficiency causes, you have B12 and folate as a important causes. So they might manifest as the neural complications or other complication of those particular deficiencies also. If you look at the inflammation and infections, so that they will sign and symptoms because of infections, tuberculosis, malaria. These are the commonest infection associated with anemia. They will have their own manifestation. Now we come to the genetic causes. Thalassemia and the sickle cell are the two predominant uh, diseases that manifest. So in cases of thalassemia trait and sickle cell trait, basically you don't see the manifestation of the disease per se, but you have mild anemia, mild to moderate anemia. In cases of disease, thalassemia disease, that is a homozygous state of thalassemia and sickle cell disease, then you see the severe form of anemia also with thalassemia. And in case of sickle cell, you see the sickling and the manifestation of those sickling. Coming to the treatment, overall, iron supplementation remains the single most important treatment of anemia. And second to that, the cause-specific treatment. For non-iron deficiency, we need to supplement with B12 and folate. Tuberculosis, you have to deal with tuberculosis, background inflammation. So you have to have intervention addressing those inflammations. For thalassemia major and sickle cell disease, the respective treatment for these diseases needs to be instituted. Thank you.
Thank you for breaking that down for us, sir. Now, my next question is that while nutritional deficiency, particularly iron deficiency, is commonly associated with anemia, the condition has a more much complex etiology. Can you shed light on the various causes of anemia beyond nutritional deficiency and explain the main factors that contribute to its development?
We also talk about, especially in Indian context, the background inflammation. Iron deficiency, though, is the single most common uh, uh, factor for anemia and varies from 30 to 80% in different geographies and different age groups. But in Indian context, especially, we talk about the leaky gut. Basically, the background inflammation of your gut predisposes you to decrease absorption of anemia because there is something called you have to understand the biology of iron deficiency. It's one of the most tightly regulated macronutrient in the body. So basically, once there's and it is, though it is very critical, essential for the human body because it's linked to oxygen carrying capacity. It is also important for the infections and the invading microbe because they are also dependent upon iron. So body has a very complex homeostasis for iron deficiency, and most of it is controlled at the gut level. So once there's a background inflammation or infection in the gut, that I think most of the Indian population does suffer from that subacute inflammation infection. There is upregulation of hepcidin in the body, and which predisposes or inhibits the absorption of iron. So that sort of complicates the iron deficiency or assimilation of iron that we take through oral route. Coming to other non-nutritional causes, I already said infections, inflammations, even inflammation, non-specific inflammation associated with obesity is also linked as one of the etiological factors for anemia. Genetic disorders, I think we are very well aware of. So larger, basically, once we were devising this program called Anemia Book Bharat. So we looked at the other non-nutritional causes. One of the key strategies, six strategies. It's one of the six strategies where we look at. So you look at fluorosis, that could be an important cause of non-nutritional anemia. You look at sickle cell disease, thalassemia, genetic causes which could manifest as anemia. So now there is an understanding that even in these conditions, they are iron deficient conditions, you need to supplement them with iron, and wash interventions are also critical. So sort of control of open defecation has made seminal changes in this thing. So you also need to control hookworm infestation, other ankylosoma and other worm infestation that also look at. So if you have to address anemia, I think you have to look at the 360-degree picture. Other causes of anemia also, larger wash, infections. Like in pediatric age group, there has been a decrease in, and one of the only age group which has shown some decrease in anemia prevalences over the years. So what we have realized is maybe it is because of decrease in overall infection burden amongst pediatric age groups. So immunization may have played a role there. So these kind of intervention, I think, needs to be closely linked to anemia. And historically, we have been looking at anemia as only a nutrition problem. In that too, also as a iron deficiency problem. But we have to be mindful. And most of these things might coexist. It's not that a person uh, has iron deficiency or has other causes of it. They might coexist also. So even if you are supplementing them with iron, there is need to address other causes so that the optimal hemoglobin status of an individual can be addressed. One thing I also want to highlight here, even in individual with normal hemoglobin levels, they also still might be iron deficient. Around 25% of individuals with normal hemoglobin might be iron deficient. So I think we need to address that factor also once we are looking at etiology, because these are at risk of developing anemia at a later stage. They are suboptimal iron levels, iron stores are less. So once they sort of are challenged for iron requirement, like growth spurt in children or in pregnancy or some other infection, so they might end up with anemia. So I think that also needs to be addressed.
So though you have already explained it very well, I would like to ask that given that anemia has a variety of causes beyond nutritional deficiencies, what is the importance of taking a multi-phased approach to tackle anemia?
Look at the WHO comprehensive framework that has recently come out to address anemia, or look at the Anemia Mukt Bharat framework, which adopted the UNICEF malnutrition framework. So we do understand that we need to address the whole uh, multifactorial causes of anemia. More than that, what we are proposing, or Anemia Mukt Bharat has proposed, is looking at anemia, addressing anemia from health system perspective. Basically enable individual to access health system and provide those services. So if you look at, without sanitation, without access to wash services, without improving the education around this thing, SBCC's social behavior change component around anemia, making it a Jan Bhagidari or people's movement, will not be able to address anemia. Because one thing we have to be very cognizant is that anemia is the single most disease or condition affecting global population. Around 1.6, 1.8 or 2 billion, you can have, pick your number, population globally are affected by anemia. In India, the percentages are even higher. We are looking at somewhere around 50 or 70% of our population being affected by anemia. So numbers are huge. So unless until it becomes everybody's movement, everybody's cause, we are not going to address anemia. We are not able to control anemia, because what we have till now done is like a drop in the ocean. We have only addressed pregnant mothers historically, though we are one of the countries which started anemia control program way back in 1970s, one of the pioneers in launching an anemia control program globally. But we tend to focus only on pregnant mothers. So we know that now historically not every pregnant mother used to access health system. So even that the coverage was suboptimal. To club with that, the problem is even those who access health system, not everybody gets iron folic acid or other anemia intervention. Among those who get, not everybody consumes. So coverage and consumption also are different. So these are the factors that affect anemia control. And we are hopeful that with 6 into 6 into 6 strategy of Anemia Mukt Bharat, which looks at all the age groups, which is based on life course approach, which looks at 6 interventions, which addresses all nutrition, non-nutrition, other causes of anemia, and which has 6 institutional mechanisms to implement these intervention among these 6 beneficiaries. All multifaceted approach to anemia would be implemented.
Absolutely. It's clear that a broader strategy is needed to make a real difference in in tackling anemia. So anemia not only affects physical health, but can also have far-reaching socio-economic consequences and impact mental well-being, leading to conditions like anxiety and depression. Could you elaborate on how anemia influences both physical and mental health, and as well as its broader socio-economic implications?
As I told you, anemia is very closely linked to the cognition or mental development. In fact, iron or iron deficiency has the strongest linkage with cognitive development, even more than the much more widely known iodine deficiency disorders. So, if a country has to become a developed nation, it has to harness its full uh, uh, human potential, human resource potential. So, it's very critical that anemia is addressed. Beyond cognition, anemia is also linked to physical performance, physical development. So if you have to excel in sports, you have to garner more medals in Olympics and other international competition, then it is imperative that the young children born in this country have optimal anemia status, because hemoglobin is one critical component where iron is a important component, but you also look at myoglobin, which is a muscle protein. There also iron is an important component. So that's where physical performance, physical development, also your muscle mass is closely linked to the iron status or of anemia status in the body. So that said and done, we have to focus. And the problem is, if you only address pregnant mother, it is already too late to intervene. The window period available in pregnancy is only 6 months. And so what we propose is the life course approach. Young children, when they are born, so they should be optimized with iron and ensure their hemoglobin is optimal. Adolescent girls who are going to be mother in next 4, 5, 10 years, they should be uh, properly addressed. Their hemoglobin status, their iron status should be optimized. So that approach, because if you look at the whole population per se, now a lot of interest is being there in women of reproductive age group. Geriatric anemia is becoming an important age group. Daily living activities of elderlies are closely associated with their optimal hemoglobin status. So these are the factors I think which can contribute, and both I always say a country can only become, India right now is from a low income country has become a middle income country. So if it has to attain its rightful place among the developed nations of the world, anemia has to be controlled and addressed. Thank you.
It's clear that anemia doesn't just affect the body; it impacts whole lives and communities. My next question is from women of reproductive age only. So, women of reproductive age are particularly vulnerable to anemia due to various factors, and it is linked to numerous adverse health outcomes. Could you explain how anemia affects not only mothers but also the cognitive and physical development of the infants and the children?
So anemia basically its linkage is more closely with iron rather than anemia per se. So iron is a critical component of various enzymes in the body, which determines your interaction between various systems of body. So that's where the cognition gets affected. It's also a critical component of your various protective enzymes of the body, which help you in fighting against the infection. So that's how it's linked to mortality and morbidity. So I always say iron is a double-edged sword. It is essential for uh, body to protect against the invading microbes, but it is also essential for the invading microbes to attack body. So that's why it is very closely sequestered. It's not available in unbound form in the body. So that's how it is there. There are various studies which have longitudinally followed anemia status and iron deficiency status and documented birth outcomes among children. There is effect on uh, low birth weight, like particularly on preterm birth in the mothers who are iron deficient. The mortality and morbidity because of pregnancy is much higher amongst mother who are iron deficient, even amongst those who are mild or moderately deficient. Cognitive physical, I've already said it is very closely linked to the cognition and the physical development of infant children, basically because of muscle mass, cognition because of linkages with various enzymes which cross the blood-brain barrier and helps in developing of your this thing. Recently, there have been some association of iron with diabetes also. So all these things are still exploring because a lot of biomedical research is still needs to be done in the area of iron, and we are finding new and new uh, condition that are associated with anemia per se and iron deficiency also. Thank you.
That really highlights how vital it is to address anemia in women, especially during pregnancy. So, in a study on IFA supplementation among pregnant women, in which you are also an author, it was mentioned that low coverage was attributed to issues like inadequate funding, supply chain problems, and low community awareness. What strategies can improve IFA supplementation uptake during pregnancies?
Basically, for success of any public health program, three pillars are very critical. One is supply chain, because you have to ensure that whatever intervention that you are planning in that program are available to the masses, to the last person in the line. Second is the social behavior change communication. Even if the intervention is available, people should be willing to take those interventions, because we have to understand even a small intervention requires a lot of modification, adaptation at the part of the community. The third component is monitoring and evaluation. Only things which get monitored or measured ultimately gets done, because ours is a huge country, so we have to be very stringent on monitoring and evaluation. Unfortunately, for IFA supplementation, all these three components were missing historically. If you look at any earlier attempts program, 1972, subsequent 1998, and NIPI in 99 and 2013, they were only policy documents. They were not enough focus on the supply chain, social behavior change social behavior change communication, on monitoring and evaluation. Only with Anemia Mukh Bharat being launched in 2018, a renewed focus and more importantly, resources to strengthen all these components were addressed. Coming to the pregnant mother, when we say this, they don't consume IFA that is given to them, we have to be cognizant of fact that only 30 to 50% of mothers were being given iron folic acid for 100 days or 180 days. Out of these, only 10 to 30% were consuming iron folic acid for more than 100 days. So the supplies were not there. Even if supplies were there, the mothers were not being counseled or adequately uh, sort of told that you have to consume this. And the issue with iron deficiency, unlike anemia, unlike other condition, is you have to take this intervention at least for 100 or 180 days. So it's not a one-time intervention. Immunization is one-time intervention. You can do it directly in front of you and then that gets taken. But this is the alien, and pill popping is alien behavior. Just imagine yourself in that woman's place. None of us would take an intervention for 180 days unless until it is being very clearly counseled. And India's health system is so overwhelmed with patients that is next to impossible to counsel everybody for the criticality of this. Now, to address this issue, we are extensively Niti Aayog, NCRA, that is National Center for Excellence in Advanced Research, and ICMR. They got together and reviewed the AMB program that has been implemented for 4 or 5 years. We realized that unless until the coverage is in 80%, 90%, there will not be any impact on the reduction in prevalence of anemia. So various modalities were addressed. Engaging community workers, ASHAs and ANMs and ICDS workers to ensure that every woman, when she reaches her home from the health system, consumes these tablets. Involving women health self-help groups. Some of the states have extensive networks of these self-help groups. They could be engaged. If nothing works, even a idea of direct observed treatment, that at least first dose in a week or 2 doses in a week should be administered in front of the individual healthcare functionary, community frontline worker. So that would address it. Basically, the problem is around 10 to 30% of women would have side effect because of iron and folic acid. But luckily, that side effect may be transient, and it is not very disabling for mother. So if you counsel her sufficiently, I always say if a mother who is willing to undergo a side effect of pregnancy, that itself is a huge discomfort to mother. If you counsel her adequately and tell this is for the well-being of your child will be born healthy, they would be willing to take those 180 tablets throughout the pregnancy. But somebody has to reinforce that idea again and again. So I think that's where the focus on this, and we are happy to share that there has been some improvement in this thing, coverage of IFA. One other problem that I would highlight for our audiences. What we realized was health system, we were focused on supply chain. Health system basically was procuring IFA based on the current coverage. So if current coverage was 30%, they were procuring IFA for only 30% of population. So that led to chicken and egg situation, because most of the places there would be stock out, and if stock out, the women would not be consuming. Health system very easily would say these people are not consuming because of side effects. So we made sure that all health facility, right from the primary health level to district headquarters to state headquarters, should forecast 100% requirement not only for prophylaxis but also for the therapeutic anemia, not a treatment, which is double the dose in most of the cases. So once we did that, so there was saturation of supply chains, and down the line there was some improvement in this thing. But these are still early days. We are still to extend uh, this model to other age group, because pediatric age group the coverage is very less. Uh, for adolescent, it's 30-50%, but can still be raked up to 70-80%. WRA, we are not talking at all now. So I think that also needs to be started. Thank you.
Those are practical solutions that could make a difference in increasing the uptake. So my next question is that what role does community engagement and targeted messaging play in improving anemia prevention effects? How can behavior change communication strategies be effectively utilized to increase awareness and uptake of IFA supplementation among pregnant women?
Social behavior change communication, I think, is one of the most important component of any health program, any nutrition program. In anemia, it becomes even more important because this is an invisible disease. So, and it is being invisible, it is also a very common disease. So everybody gets affected by it, and none of them seems to have very serious disabling complication because of it. So people are got used to living with anemia. 9, 10 hemoglobin, people are fine with that. So I think to change that, so there has to be a whole mass movement of what we call a Jan Bhagidari or Jan Andolan, where people stand up and say, this is not something that we are okay with. Because let's start with the case of pregnant mother. So there are a lot of complication in pregnancy if you are anemic. So a lot of postpartum hemorrhage, preterm labor. India has one of the highest preterm birth rate in globally. Postpartum coverage also has to be there. So these are the factors that affect your community perception. Community mobilization is an important component, and more so because the number of beneficiaries are so large that health system on its own will not be able to tackle it. So we are trying innovative models using community outreach workers, using various social health group, using non-governmental organizations also. There have been some talk around using the social media to address this. So various states have been doing this. I think some of the states have been successful, and then we did small uh, sort of a study or implementation research activity in one district of Faridabad, where we screened all school-going children in that particular district. Got involved the health education department and health department, and more than 1,20,000 children were screened in 1 month duration, and treatment was given in addition to prophylaxis. Anemia prevalence came down by around 30%. So it is not that this cannot be addressed, but addressing it does require huge amount of mobilization of resources, both monetary resources as well as the human resources. So I think this is very important.
Given the geographical disparities in the prevalence of anemia, how important is it for policymakers and decision makers to develop localized treatment plans? And what factors should be considered when tailoring intervention to specific regions?
More or less, I think the whole of India suffers from this malady. So though it does make sense to have national level interventions, but I think the causes might vary a bit in different geographies. So like in Northeast, if you look at hemoglobin E is much more common. that might be a cause and it leads to mild anemia. So, and you have to be careful for that. In central parts of India, in Madhya Pradesh, Chhattisgarh, parts of Gujarat, a typical sickle cell belt, you have sickle cell disease much more common. So there you have to look at sickle cell and anemia, because sickle cell becomes more important. In areas where malaria is endemic, so you have to look at malaria as one of the causes. Iron deficiency, those important cause in all geographies in India, but it might vary in the severity or grade in different parts of our country. So I think this is what is required.
So my last question from you is, what are some of the most effective strategies for preventing anemia, especially in high-risk groups such as women of reproductive age and children? How can individuals and communities take proactive steps to reduce the prevalence of anemia through diet, lifestyle, and early interventions?
I think one of the foremost thing is everybody should get tested for hemoglobin. They should know their hemoglobin levels, and if they find it deranged, they should get appropriate treatments. There's a lot of buzz around what is known as T3 camps, test, talk, and treat camps, which are used as advocacy modality for community mobilization. Also, individuals. So rice fortification is a national level program of Honorable Prime Minister, and around all rice being supplied in PDS, midday meal, and ICDS is fortified with iron, around 6 to 8 milligram of iron. So that is 1/3 of your IDA of iron, and around, so that way around 30% of rice supplied in or consumed in whole of India is fortified. So food fortification also does play an important role. And lastly, I think individuals have to realize the long-term and the most sustainable solution for anemia and iron deficiency anemia would be dietary diversity. So the classical rainbow plate, if we consume different type of foods, including animal source food, on a daily basis and balance it out. So I think that is a long-term solution to problem of anemia. But unfortunately, our diets are becoming more and more uh, bland, and they are not rich in micronutrients now. Most of us are, because of paucity of time, money, and various other factors, are consuming only one type staple cereals, which doesn't have much of green leafy vegetables or animal source proteins available in that. So that is a secular trend where it is showing that our diets are worsening. But I think there has to be a lot of discussion around this. If anemia has to be tackled, the diets have to be improved.
Those are some actionable steps that everyone can take to make a difference in preventing anemia. That brings us to the end of today's episode. Thank you so much, sir, for such insightful information on anemia, its impacts, and strategies for prevention. Anemia is a multi-phase issue, but with the right knowledge and action, we can significantly reduce its burden. Stay tuned for more health-related discussions, and thank you for listening. Thank you so much, sir.
Thank you.